Visualize a large metropolitan city, culturally and socioeconomically diverse, with over 350,000 individuals in the safety net population. Of this number, over 4,700 are super utilizers of the healthcare system. Over 8,200 are homeless, and over 37,000 are mentally ill. And there's still that subset of the population who are homeless, mentally ill, super utilizers. Care for this population is complex, and the cost exceeds over $1 billion annually. That's billion with a B. You can imagine the complication of these factors, strained and inefficient systems of care, leading to challenges in access to care for the community, resulting in poor outcomes for individuals. This could be any number of cities in the United States.
Now, imagine a scenario where healthcare providers, public safety entities, city and county government, nonprofit and philanthropic organizations are coming together to improve the continuum of care for the least served residents. This is the Southwest Texas Crisis Collaborative, formed in 2017 right here in San Antonio, Texas. On a normal day, healthcare systems who are market competitors have come together in a unique partnership to include shared planning, decision-making, and accountability. In addition, they are financially supporting the collaborative.
After much discussion and planning and strategizing, we were able to embark on an infrastructure building year in 2017 with the $4.9 million grant from Methodist Healthcare Ministries. As a member of the collaborative, Methodist Healthcare Ministries has made an additional 4-year commitment to provide $20 million in funding to support the development of programs and initiatives, thereby allowing the collaborative to implement new and innovative solutions like the ones you'll hear about tonight. The city's 6 healthcare systems invest a collective $8 million each year. There's also funding from Bexar County and from the San Antonio Area Foundation. We're also leveraging local resources as well as state funding.
At the helm of the collaborative is the Southwest Texas Regional Advisory Council, serving as the backbone, keeping all of the pieces and parts connected. Given STRAC's charge to develop, implement, and maintain the regional trauma and emergency response system, and its already established relationships with healthcare providers and public safety entities, this has been a natural and effective role.
The Southwest Texas Crisis Collaborative is focused on filling in the gaps and improving the linkages in the continuum of care for the underserved and the most needy among us. We are excited to share with you tonight about the initiatives that we have launched and the successes that we have achieved to date.
The first initiative was the MedCom Law Enforcement Navigation Program, an effort to increase access to psychiatric care for individuals experiencing a mental health crisis who are otherwise medically stable. Rather than the outdated practice of taking that patient to the closest emergency department, MedCom Dispatch Center is navigating officers and the patient to the closest, most appropriate mental health facility. This is based on things like age, gender, and bed availability. We have seen a 97% adoption rate by law enforcement so far. 26 law enforcement agencies are trained in using the program. Prior to law enforcement navigation, our local emergency department saw over 9,000 emergency detentions each year. In 2018, we saw a total of 9,310 navigations directly to appropriate psychiatric care. This has helped to reduce emergency detentions in emergency departments by 50%. It has increased capacity for emergency departments to care for patients experiencing medical emergencies. Only 1% of navigation requests resulted in a transport to jail. The goal is to transfer the patient within 20 minutes so that the officer can get in and out and back into duty. This is a win-win in many ways, but most importantly for the patient.
Haven for Hope holds the distinction of being the #1 address for 911 calls in San Antonio. The focus of the second initiative that we implemented was to decrease the overutilization of 911 from the residents at Haven for Hope, and to also decrease the EMS transport rate for non-emergency situations that could be managed otherwise. To that end, we implemented an acute care station at Haven for Hope. The San Antonio Fire Department has a cohort of paramedics who are specially trained in their mobile integrated health model. There's an MIH paramedic assigned to respond to all of the 911 calls from Haven for Hope. They assess the situation and make a determination about how best to proceed. In the majority of cases, the patients were able to be treated there on the scene and released without the need for any additional care. In other cases, patients were treated and then scheduled for a follow-up appointment the next day at Central Med, which is the federally qualified health center there on the Haven campus. And of course, there were situations where the patient's condition required that they were transported to the local emergency department. We have been able to decrease the EMS transport rate by over 70% in 2017, down to about 17% in 2018. Think about how significant that is. Just looking at the cost, there's a savings of the ambulance transport, which is about $900, and the savings of the emergency room triage, which is at least $1,000. That's a roughly calculated savings of over $665,000 already. And not to mention that this helps to free up the emergency resources so that they're available to respond to true emergencies in our community. Having the acute care station at Haven for Hope also allowed San Antonio Fire to identify one of their highest utilizers. This individual had called 911 28 times in the month of July. They were able to connect this individual and put them on the regular caseload of one of the MIH paramedics who could connect with that individual and help them to make use of more appropriate resources rather than using 911 for non-emergency care.
The third key initiative was the expansion of the Psychiatric Emergency Services Unit, also known as the PES. The PES is an emergency room dedicated solely to psychiatric crisis intervention. The patient will see a psychiatrist within 4 hours of their arrival. Their length of stay can range from 48 to 72 hours. Using MedCom as the navigator, we were able to implement an interfacility transfer program where emergency departments could transfer the medically stable patient directly to the PES. In just 10 weeks of implementation, we saw 922 successful transfers. In the past, this type of transfer could take days, prolonging access to care for the patient. With this program, we were able to reduce that time to about 2 hours.
In late 2018, we welcomed Crosspoint Incorporated as a provider to the collaborative with the implementation of a behavioral health diversion program for individuals with the mental health diagnosis transitioning out of jail or inpatient hospitalization. They're able to receive 24/7 residential support, group and individual behavioral health services, as well as case management. We've also been working to develop the TAF Connect technology platform, which will allow us to more effectively connect the dots and the providers in the system of care, and to more effectively track and manage the patient's social determinants of health, with the focus on improving outcomes for each of the individual patients. We currently have 8 healthcare providers online and using the system, and we expect to deploy TAF Connect to additional collaborative partners in 2019. These are just a quick summary of the successes that we've shared and a brief overview of the projects that we've implemented in these formative years of our collaborative. We know that there is still much more work to be done. The most exciting part about all of this is that it is improving the continuum of care, and it is proving the opportunities for access to appropriate care for the most vulnerable among us. And that, in turn, increases opportunities and increases outcomes for all of us. Thank you to the members of the Health Cell Board for inviting us to share our story about the collaborative, and thank you for listening.
Thank you.